Welcome to another episode of the Mirthe Precision Health podcast. In today's episode, I want to talk about testing for longevity and health optimization. A lot of people are trying to be healthy these days, which is wonderful. And there's lots of tools out there, and there's wonderful supplements and saunas that help longevity. However, how do you know you're doing it right? Now, oftentimes, people ask me, they're saying, well, I'm trying all these things, but how do I know that I'm not running into issues? I have Alzheimer's in my family. What should I do to really be most proactive without obsessing about it? Now, there are certain things called predictive biomarkers, and a lot of research has been done on them. There are different types, and the newest ones are done on our DNA, how fast our DNA, something called methylation, if that's turned on or off, and you can predict our age. But those tests are still very expensive, and not a lot of people have access to them. And also, when you know your biological age, how fast you're aging, you don't really have actionable steps to fix it. There's another type of testing that I commonly use with my patients, and that is, I think, is a wonderful addition to your health optimization toolbox. And they are blood-based biomarkers. And often these biomarkers can be just very simple tests that you get with your regular GP, your regular annual checkup. And they don't have to be fancy tests, and they already can tell us a lot about how well you are aging, if you are running into issues, if you are slowly degrading. And they can be simple tests like blood sugar balance, like your inflammatory markers, kidney health. So very simple tests, your cholesterol levels, and they can basically show us whether you are on the right track or whether you're running into issues. Now, oftentimes, these markers will show, even in the early, they've done research showing that when someone gets really old, centenarians, super centenarians, those people that get 100 years and older, they have very specific ways of blood tests. They have a similar blood result and similar metabolic profile many decades before they are getting that old. And they've done a lot of research into this, which is very fascinating. There's also research on the fact that if we are starting to test these things at an earlier age, let's say in our 20s and 30s, when people often don't think about aging yet because it seems so far away, is that we can actually make a much larger, we can have a larger impact and prevent, rather than waiting until we're already running into an issue, we're getting slightly older, 50s, 60s, then a lot of these factors have already accumulated for decades and have caused a lot of damage. The wonderful thing is that we can reverse a lot of things. That's what functional medicine is so good at. It looks at the underlying factors and looks at what's not going right, what's triggering inflammation, what's triggering our metabolism to not go so well. Do we have nutrient deficiencies or too much of certain nutrients? So we can still fix a lot of things even at a slightly older age. But the research shows that the earlier we start and we're more proactive, the better. Now, what I find really important is that you don't have to stress about it. I see this, it's kind of an interesting topic because some people get over obsessed with healthy living and then they don't really live anymore. So what's the point in it, in a way? So it's also a ethical question, and it's also what you want out of life. What's your meaning? What's your purpose? Is your purpose to live as long as possible without any fun in life, without letting loose a little? Or do you want to find a middle ground where you have a little bit of fun, where you maybe go and dance a little bit or do certain things that you know aren't perfect for you, as long as you overall balance it out? Now, with these tests, and that's what I found so wonderful, is that you can test and see whether you're on the right track or whether you are really kind of overdoing those things and you should step back a little bit and really prioritize health, sleep, all these wonderful health optimization tools more, or whether you're actually doing fairly okay. Now, one of the tools is a simple something called PhenoAge. You measure your biological age, how old your cells are, not how old you are in person, but your cells, how fast you're aging, by simply using a few blood measures that you will probably have seen in any of your blood tests. Just have a look through them, and you're probably familiar with them. And one of them is just simply by something called albumin, creatinine, glucose, C-reactive protein, which is an inflammatory marker, your lymphocytes, your type of your white blood cells, mean cell volume, which has to do with your red blood cells, your red cell distribution width, again, to do with your red blood cells, alkaline phosphatase, white blood cell count in total, and your age. And you put them all together in a formula, and it can tell you how fast your body is aging. And they found that it is quite predictive for actual problems or healthy trajectories. They found that people that have have a older age on this test than their actual age, they have a higher risk of all-cause mortality, things like Alzheimer's, cancers, heart attacks, strokes, all these things that we're kind of worried about happening to us as we get older. Because the thing is that our life expectancy has increased over the past decades, which is wonderful. So people in general, in the Western world at least, get older than we had in the past. But that doesn't always come with an increased health span. So often that means that people get older, but when they get older, they are then bedridden, frail, and they have all these issues. They're on multiple medications, and they're not really having a good quality of life. So the whole point of longevity research is that you're not just putting longer years into your life, but you're also putting life into those years. So better quality of health, better quality of life, so that you can still enjoy your life while you get older and not just, you're not very frail and actually not really enjoying those years. Now, you might be one of the people that says, why would I want to measure my biological age? Because I don't want to know if I'm all doomed and everything's not going well. Now, what I find wonderful with these blood-based biomarkers is that they actually can give us actionable steps that we can address, so we can actually do something about it. Where some of these newer markers, they're a little bit harder to kind of analyze and see what we actually need to do and what we need to change. But if we look at those markers like kidney health, blood sugar control, inflammatory markers, then we can use a functional medicine approach to look at what is causing inflammation, what is messing with our kidney health, and then we can take actionable steps to optimize our health. And that's where functional medicine comes in and shines, I find. Functional medicine can really help with longevity to make it more of a proactive approach. So for example, if we know that inflammation leads to something called inflammaging, where inflammation contributes to basically all bad health trajectory, whether that is Alzheimer's and cancers or stroke, heart attacks, autoimmune disease, all these sorts of things that we don't really want to have. Inflammation plays a role. Now, obviously, you can take anti-inflammatory drugs, which is sometimes needed short-term and can save lives and work wonders. But long-term, they often have side effects. So the next step would be, and that's how functional medicine usually works, is to say, okay, in addition to the drugs that are available that are possibly needed short-term, what can we do? Where's this inflammation coming from, so that we can be more proactive? So common steps are, for inflammation, for example, if there are chronic infections in the body that are constantly irritating the immune system and to make it pump out inflammation, or hidden food intolerances where the immune system thinks that this food that is usually healthy, but the body has developed an intolerance to, it thinks it's an invader like a virus, and it creates constant inflammation to try and kill that off. But it might be something really healthy like an almond or an avocado. So I often see in my patients that have niggly symptoms, their inflammatory markers are slightly elevated on their blood level, on their blood tests, that they have some chronic lingering infections, viral, bacterial, candida, fungal infections, mold, or they have chronic food intolerances that they weren't really aware of. And if we address that and address our gut microbiome, so we balance those infections, we make sure that the immune system gets stronger again and calmer, then those things can calm down. Other factors that contribute to low-grade inflammation can be things like not having enough of the nutrients that are needed to quench inflammation, such as, for example, omega-3. They're very important to when we have an inflammation, which is a good thing. It's a healthy part of the immune system and healthy reaction of the immune system to an invader. Let's say we have the flu, the body creates inflammation to try and kill that off, but then that inflammation should stop. Now we need omega-3s to let that inflammation stop. If we don't have enough of that, of those nutrients, then it's really hard for the body. Or if we overeat, our body is more prone to create more inflammatory molecules. If we have belly fat, excess weight, that makes us more inflammatory. And then there are also other predictive biomarkers that maybe don't usually show up in these PhenoAge, that test I mentioned before, where you can check your biological age, but that also in each individual have been shown to be linked to all-cause mortality, morbidity, problems down the line. So the way I would look at things and the way to make longevity and health optimization really proactive and encourage you to become the CEO of your own health is to look at these different blood markers that can help you make changes and choices in your lifestyle. For example, so I talked about inflammation, but there's also something called HbA1c, which is an average of your blood sugar over the past 3 to 4 months, roughly, of sugar attaching to your red blood cells, your hemoglobin. And if that's above optimal, it has been shown to contribute to a worse metabolic profile and all sorts of problems and faster aging down the line. Now, other markers as well, ferritin, for example, which is an iron storage molecule. If that's too low, our body is constantly starving of oxygen because we're not transporting enough oxygen to the cells. But on the contrary, if that's slightly high, it has been shown to be inflammatory and contribute to free radical damage, which makes our body basically rust from the inside out. There's also another marker called GGT. A lot of people know it from their liver panel on a normal regular blood test. But that if that's slightly high, they can also show that there's more, not just a problem with the liver, but that there's a burden on the body from excess amounts of free radicals and a need for antioxidants, such as the powerful antioxidant called glutathione that the body can make. But some people have a genetic mutation and the body can't really recycle it that well, has a harder time keeping up with the production. And also some people, if it basically shows if that's increased, that GGT can mean that we just need more because there's more burden on the system. Another simple blood test that has been shown to be linked to anti-aging, longevity, healthy, getting older in a healthy way is DHEA. And that's a precursor hormone to our cortisol, our stress hormone, but also to testosterone and estrogen. So those sex hormones. And research shows that as we get older, it declines. But the faster it declines, the more it is linked to a faster decline of our health as well. In particular, also our brain health, our cognitive function. And the way I would then look at things like that from a functional medicine perspective is to say, okay, well, what is depleting that DHEA? And DHEA is, like I said, a precursor, but to stress hormones as well. And if we are constantly in fight or flight mode, we're constantly stressed out, eventually the body starts producing less. It goes towards a burnout state. And that can then contribute to faster aging. So these things are all factors that you can influence. So you can check your iron levels, you can check these markers, your blood sugar balance, and then influence them through dietary and lifestyle factors. Now, the next thing that I quite like in the functional medicine and the more of a precision longevity, precision health optimization approach is to not just look at those markers and see if they are in danger zone, but to see if they are in optimal or suboptimal levels. Because often, and research shows this, is that even though a marker might be fine and you're not in danger yet, you don't have diabetes or you don't have cancer or you don't have to go to hospital basically. It can be that those markers are in the normal range, but just on the high end of the range or in the low end of the range, and are already contributing to sludge building up in the body slowly rusting and deteriorating. For example, vitamin D is one of these predictive biomarkers as well. And a normal range of vitamin D can be anywhere, depending on the lab, between 20 and 200 nmol per liter in the UK here. There's a different range over in the UK, in Europe and in the States. But we over here, we use nmol per liter. And research shows for optimal health and for optimal prevention and longevity, prevention of cancers, for example, but also autoimmune disease such as multiple sclerosis, we want that vitamin D to be in roughly between 100 and 150 nmol per liter. And if you have a genetic mutation where your vitamin D receptors don't work so well, then you might want to be even in that top of that part of the range to really make sure that vitamin D gets into the cells and can do its job at keeping the immune system strong, but not overreactive. So strong enough to kill off cancer cells, but not overreactive to be an autoimmune disease. Another commonly used biomarker with these optimal ranges that is very easy to kind of test, and a lot of people have seen it on their blood work, is HbA1c, that how much sugar has attached to your red blood cells over the past 3 to 4 months roughly. I talked about that before. That's really commonly tested in most routine blood panels, and normal ranges can be anywhere up to, depending on the lab again, 6.5% of HbA1c. And if you're above that, then you are pre-diabetic. If it goes even higher, you're diabetic. Now, if you are in that field of longevity and you're trying to optimize your health, you're hopefully far away from being pre-diabetic and diabetic, but you want to make sure that your blood sugar is optimal, so you're not constantly creating micro damage to your cells. And because every time you have a little blood sugar spike, even if you're not diabetic, it already causes low-grade damage to your blood vessels, to that endothelial lining, which eventually, if it happens for decades, can contribute to Alzheimer's, plaque formation that causes strokes and heart attacks, all these sorts of things. Now, an optimal HbA1c would be more like up to 5.2% roughly. There are different references in research, but that would be a goal to keep below that rather than not being diabetic or pre-diabetic. And then another common one that is very simple and very easily tested is ferritin. Like I said before, that iron storage molecule. Now, normal reference ranges can be anywhere between 15 to 200, 300. But research suggests that to be optimally healthy, we want that to be between 70 to 80 to 90, in that kind of range. 50 to 100 is also pretty good, but if you want to be super strict, then even narrower. But what they show is that anytime it drops below 50, our cells, even though we're not in alarm danger zone, our body is starving of oxygen and we're not really getting the nutrients to our cells so that they can function optimally. And if that happens over decades, they start to starve and not do their job properly, which is also quote unquote aging. And then on the other side, on the flip side, if ferritin, that iron storage hormone molecule, is a little bit on the high end, still a bit in the normal range, let's say it's 120, which is way in the normal range, and I see this quite commonly in my patients, it can already contribute to inflammation and free radical damage and has been linked to all-cause mortality, increased risk of Alzheimer's, to basically rusting from the inside out. So, as I said before, you can measure some simple blood tests. And you usually have already tested them in your blood panels, so there's nothing that you need to add. Most people can do it, have it at hand, so it's also cost effective. But then make sure that you put them into optimal ranges, not just into the normal range, because most normal ranges are created by looking at the average of the population and whether someone's extremely unwell, and then everyone that's okay is in there, but not optimally healthy people that optimally function into old age. Now, I briefly mentioned DNA testing before with the vitamin D receptors. Now, if you want to take it to the next level and you do want to splurge out and spend a little bit of extra money on your health, then you might want to run a DNA health panel where you can see where you have genetic weaknesses. Now, I urge you to not just go and do a DNA panel and then wildly supplement according to your DNA results. Because research over the past 5-10 years has shown that DNA really is just a blueprint, and it then depends on our lifestyle whether we actually turn certain genes on or off. So it's kind of like our genetics load the gun, and then our environment, it's called epigenetics, everything around our genes, our lifestyle, our diet, mental health, situations we are in, pollution, they are around the genes and they pull the trigger. So they found that actually some people might have, let's say, an Alzheimer's gene, but never develop Alzheimer's because they're doing everything right. Another person might have no Alzheimer's gene, but develops Alzheimer because they're doing everything wrong. So what I like to do with the DNA testing, and I've kind of gone off it and I don't run it that often anymore because people were so obsessed with their DNA results that they would then just go and blindly supplement. Like I said, for a really common example is that if your DNA results show that you're more prone to peeing out zinc when you're stressed out, you can test whether you have a predisposition for that. Now, if you're then going to just wildly supplement zinc, which a lot of people do, a lot of companies recommend that, you might actually run into the risk of overdoing it. And overdoing zinc is not a good thing either. So a lot of these nutrients in particular, there's a bell-sized curve. You don't want to be too low, but you also don't want to be too high. Same goes for a lot of the hormones. So just giving someone, let's say someone has that going back to that zinc, maybe they are intuitively aware that they need to eat a little bit more zinc-rich foods and their zinc levels are perfectly fine, even though they have that genetic predisposition. So I always recommend also testing. And I've seen this over the years with my patients that I test the DNA and then I test the actual biomarkers, what's actually going on in their blood at that moment, or blood or urine, they're different way, or stool, depending on what we're looking for. And oftentimes, even though they have a genetic predisposition, there's actually nothing wrong with them and they're doing everything perfectly fine. Just intuitively, they've adapted a type of diet where they eat more zinc or they need more vitamin D and they just crave more sunshine and they go and get it. Or they are more prone genetically to inflammation if they don't get enough sleep, but they really prioritize their sleep because they just don't feel good if they don't get enough sleep. So oftentimes the genetics just show us our blueprint. I do like it though as an add-on. If you have some extra cash, first go and do your actual blood panels and see where you're at right now. It's more important. But if you have some spare left, then go and see where your weaknesses lie so that you can be a little bit more, precise and proactive on where to target, what to test, so you're making sure you're not running into issues. Now, I hope you found this helpful. Comment below, let me know if you have any questions, if you would like for me to elaborate on any of these topics a little more. And as always, I hope you have a wonderful rest of the day, and I speak to you soon.